Hi, I'm Fiona. Welcome to Caithness Movement Therapy. In this video, I want to talk about using somatic movement to release tension and sometimes pain in the temporomandibular joint, or the TMJ. So the TMJ is the jaw joint. It's the joint where the movable part of the jaw actually attaches to the skull. It sits just in front of the center of the ears, coming down slightly. And if you want to pop your hands on your face and you move your mouth, you can feel it moving under your fingers. This is an area that carries a lot of tension in a lot of people. It comes through mechanical reasons, emotional reasons. Mechanical, a lot of us tend to chew on one side of our mouth all the time. You might have a history of dentistry issues. And emotion, it's one of those things that we tend to clench up when we're stressed. And that might be ongoing stress, or it might be something that happened in your past, but you've not learned to release. There's an awful lot of muscle groups sit around this joint, and they extend right up into the sides of the temples and also down further into the cheeks. So an awful lot of problems in different muscles can create pressure within the TMJ. So we're going to explore it. We're going to use some what we call assisted pandiculation to help release it, and hopefully you'll find it helpful. Okay, so to start with, you want to just scan as we normally do. So letting your body relax, make sure your shoulders are soft. You can close your eyes if you want to. Just take your attention into your face, thinking about your cheeks, your tongue even, around your temples. What do you feel? How does that feel in this moment? You might not feel anything, and that's fine too. But sometimes you'll just pick up on a tension or a discomfort that might or might not be something you notice day to day. But now you're giving it the space and the time to draw attention to it. It starts to give you feedback. Okay, so let's do some palpation. Let's find out what your fingers feel when you touch around this joint. So coming to just in front of your ears, if you want to, open and close your mouth a couple of times so you know where the joint is under your fingers. Okay, and then just gently palpate around the joint. You don't want to press too hard and you start to lose sensation and feedback. If you're gentle, you feel more. So what are you feeling for? Anything that gives you feedback and information. But as an example, you might find that those muscles feel tight under your fingers. You might find that one side feels firmer than the other. You might feel that they feel soft and what we call flaccid. Muscles, a good healthy muscle has bounce to it, it has tone, it has some resistance. An over tight muscle feels quite often rock solid under your fingers and can be quite tender to touch. A muscle that's having problems working at all can become underactive and become what we call flaccid, so it kind of feels slightly soggy and doughy under your fingers. So you're looking to feel what you feel each side and compare how the left side feels with the right. So just have a good old poke around and see what you feel. Also, you might notice areas that are tender. Sometimes you get what we call trigger points around this joint in the muscles, and that's where the tissues are sticking together. They're not flowing over one another like they should. There's not enough fluid in the area. There's not enough nutrition and hydration. And that can be quite tender. So take a note of that as well, because it'll be interesting to see whether those feel the same when you finish or whether they've changed. Okay, and then come to your movement. So putting the flat hand against each side, on just resting gently over the TMJ, you're going to open and close your mouth. So just a straightforward movement. Once or twice. And if you continue to do this, because I obviously can't while I talk, then notice what you feel. Is it comfortable to open the jaw? Does it feel smooth under your fingers? Or is there a catch? Sometimes you'll feel that it feels jerky on one or both sides. It might not be particularly pleasant. It might be quite noisy. Sometimes the joint can get quite a lot of what we call crepitus, and you get those crunching noises as you open and close. Also, you might notice that it doesn't come straight down and up, it jumps off to one side or the other. And that happens when the muscles are tighter on one side. As you open, they pull the jaw, the mandible part of the jaw, to one side, and you get an uneven bite. And that can cause an awful lot of dental issues, excuse me, as well. So just notice what you feel. And then one last check of how your movement is in the TMJ is to circle the lower jaw. So just gently and never with any strain. Remember, always keep these explorations comfortable. Your body will have a natural edge. You want to stay below that edge of pain or discomfort and just explore what you can do. It's not about proving anything or forcing anything. You're finding things out about your body. Okay, so just taking the jaw in a circular movement, it'll look something like this. And then exploring in the other direction. And again, you're wanting to notice how that feels. Is it smooth? Is it easy? Does it feel the same both sides? Or is it quite noisy and jerky and unpleasant? If it is, it's a good indicator that there's a lot of tension within your jaw. Even if it's fine, there's still no reason you can't use this pandiculated flow and try and help your body make sure it's resetting and repatterning the nervous system from brain to around the TMJ. Okay, so we're going to use something called assisted pandiculation, and that's where you use your own strength in your hands against the movement of the body. Now, this kind of creates an impression that you're going to be forcing things. You're not. It's an extremely light touch. It's extremely gentle. Okay, so first of all, we're going to bring the jaw into an opening through pandiculation. So remember, pandiculation, contraction, controlled release, and then complete relaxation. And when you build in contraction with assisted pandiculation, you build a load between your fingers and the muscles that you're engaging. So you're going to be bringing your lower jaw up and slightly forwards. So it'll come up and sticking your lower teeth slightly out. Remember, never any strain. And if you find any of these movements are too uncomfortable, remember you always have visualization available. Close your eyes, listen to the instructions, and imagine that you're making these movements, okay? So using your two index fingers, you're going to place them in the groove just above your chin and under your lip. Bring the chin forwards and up slightly. And then place gentle pressure against that movement with your fingers so you find balance. Nothing's going anywhere. Notice what that feels like. And then you are going to allow your fingers to have slightly more pressure than the jaw. So the fingers take the jaw into an open position, but you still keep resistance. The jaw still wants to be closed, but the fingers are going to bring it open. It takes a while to get used to creating that sense of balance without strain. But have a practice, keep at it, and it will come. So create your load. Allow the jaw to open. And then release. You'll find there'll be a natural stopping point as you open the jaw that it feels like that's as far as it wants to go. Should never be uncomfortable. If it's uncomfortable, drop it back a little. Okay, let's try that again. Build your load. And release. And all the time be aware of what you're sensing. That interoception, that inside sense is so important in somatics. It helps you understand and engage and connect with your body, your nervous system, and allows the brain to be more aware of what's going on, and it can make changes that you need. Okay, one last time. And completely relax. Make sure that your neck is soft and released. You feel like the top of your head is floating away slightly towards the ceiling. Very easy when you're focusing on the jaw to bring the chin forward. So just remind yourself, lengthen your neck, soften your shoulders, soften your abdomen before each movement. Okay, so we're going to do the opposite now. We're going to open the mouth first, and then the thumbs are going to bring it closed. So you open the mouth, place the thumbs underneath to build your load. And then you allow the thumbs to bring that mouth to a gentle close, no force. And then relax. Allow your hands to come down into your lap so you're completely switching off your shoulders. Let everything soften. Notice what you feel. What sensations does that create in the jaw and the face, maybe even the neck and shoulders? Okay. Gently open again, build your load. And release. Remember, as the thumbs bring the jaw up, the jaw's still gently resisting. It doesn't want to close. So you're actually asking muscles to change while they're engaging. And that's a really effective way of creating feedback to the brain and engaging the repatterning that we want to happen. One last time. And relax. Again, make sure the shoulders are soft. Neck doesn't feel tight. You can give your head a little wobble or a little rotate and just make sure everything's relaxed. Okay, so let's address sideways movement. Again, you're going to use your fingers nice and gently, build the load, create the movement, which is the release of contraction, and then completely relax. So take to one side, use your first two fingers. Then your fingers are going to take the jaw across. They might want to stop in the center, or you might find that it's going to carry on past. That's fine. So engage, or have your mouth slightly gently open so you're not grating your teeth together either. And then release. Let everything go. We're going to do that twice more. So build your load. And then release. Last time. And relax. Now notice how that feels one side to the other. Does it feel different? Are you aware that there's been a change on the side that you've just worked compared with the other side? And then let's repeat that. So to the side, mouth slightly open. Build your load, keep the resistance, but allow the fingers to take the jaw across. Soften everything. One last time. And then let that relax. Okay, so give your jaw a wobble and a wiggle. You can come back to that circling movement, see how that feels. Is there any less noise? Does it feel different? Is it smoother? And if there isn't a change, don't worry about that either. Remember, in somatics, we accept things as they are. There's no good or bad or right or wrong. It's like, okay, if that's not going to change today, I'll try it again tomorrow and then see what response I get. Sometimes when you've got a lot of tension and it's something you've been carrying a long time, it takes a long time for the body to start to change. And also, it's not necessarily that the body's not changing. It's that you're so used to that tension and that sensation, the brain doesn't actually recognize the change to start with. So have patience with your body and yourself and keep working at it. Okay, so let's come back to the TMJ now. Give it a nice gentle massage, gentle rubbing movements, whatever feels good, right up to the temples. And then back down into the cheeks. While you're massaging, notice if there's any change in the texture or tone of the muscles. That's also a giveaway. Sensation is your biggest one, but biofeedback, such as your touch, things like that, are really, really helpful to you too. And then coming back to that movement up and down, again, flat hand over the TMJ and open and close. You're looking to see if there's any more mobility. Perhaps you can open the mouth a little wider, more comfortably. Also, is it straighter? Is it smoother? Sometimes it's the quality of the movement that actually gives you an indicator that you've had a change. Okay, let's just finish with a cleansing breath there. So breathing in through your nose. Out through the mouth, let everything relax and release. Neck, shoulders, spine and belly, sinking towards the ground. And then if you wish, you could close your eyes, do another scan of your face and your jaw. Or just sit for a moment and enjoy the sensations that you've created. Thank you for joining me today for this video. I hope you find it helpful.